Let me pause for a moment and check in. How good is it to hear stories from people who are living the story? Powerful. We've got two more lived experience speakers in this morning's session, two very dynamic people, and they want to share their story of family with you. I don't want to formally introduce them individually. There's plenty of information in the bio. I want to leave the story for them to share about them, and I'd welcome to the stage, if I can, Mahlie Jewell and Kyla Cassells. Thank you.
Hello, my name is Mahlie, and I'm a lived experience advocate, and this is Kyla.
I'm Kyla. Mahlie's been my best friend for like 20 years. We met when I was about 15 years old. So I'm a pretty dull person. I work in government. I'm a low-ranking bureaucrat. Known Mahlie for about 20 years. We've been through lots and lots of stuff over that time together. Which is great.
Excellent, and that's our presentation. Thank you very much. We want to talk a little bit about chosen family, and it's kind of come to our attention that not everyone understands what that means. We come from communities where that's pretty common. So what that means, obviously, is that we choose to be in each other's lives, but it's different from friendship. So there are the same levels of involvement, expectation that many of you would get with your sisters, brothers, husbands, wives, aunts, uncles, parents. So it's more than a friendship. This is my person and I am her person. And so one of the things that we really wanted to talk about is the difficulties that we've had within the mental health system that doesn't recognise those types of family relationships. And so often we lie. So on pretty much all of my next of kin, Kyla is listed as my sister. And we kind of go along with the idea that people assume that we're biologically related. And so for me, as a person with lived experience, I've often had the person that I chose to be my next of kin completely overruled by things. So for a long period of time, it was my primary partner. And simply because of that person being the same sex as me in this country that we have lived in, she was often overruled. And quite scarily, often my mother, who was highly abusive to me, was brought in on that, yet I'd had no contact with her for decades. And so that's been a big issue for me pretty much my whole entire life. And I think Kyla's become, unfortunately, involved in that a little bit. You've got your own stories. You can tell one of them.
Yeah. I think it's funny because people do struggle a bit around the place to understand chosen family a bit, because it's like, well, we are quite intimately involved in each other's lives. You know, it's like when we were talking about this, like our relationship a while back, Mahlie said, you know, in terms of describing our relationship, she wrote this in an email. She said, you can say chosen family, you can say support person, you can say whatever it is you like. Friend, teacher, mother, sister, frenemy, advocate, hard ass, then in brackets, not really. Emotional punching bag, the grown up. Realistically, in our situation, there are times when you have had to be so many more things. And I think that's a really nice sort of capturing the kind of complexity of our relationship. And it's totally two ways. Like, I think that's the other thing about it. It's not just like, you know, I've done these things for you, but we've been through a lot together, and all the things that I've done for you, you've done for me at times as well. So that's, yeah, you know, and we're definitely family, and I would never dream of having it any other way. There are some challenges that come with that. I don't know, should we just want to talk about them? Or does anybody want
want to ask some questions. Like, we would really prefer it if people could, like, maybe ask us what they're interested in hearing about, or situations that we've been through, or how we've been responded to, or anything.
So as I make my way over to this gentleman over here, I just want to just ask a question as a travelling question. And this question is, the system is really rigid at times around family. And, you know, for many biological families, it can be challenging to be able to participate. And yet, being able to sort of tweak the system in a way to say, I self-determine definition of family when the paperwork says this. Be really interesting to understand. You've navigated it by fibbing, but is there something bigger that we need to be doing within the system to sort of promote that wider understanding, do you think? Do we have a second backup mic or just the one? Okay. All right. Can you speak from the lectern one at a time whilst I do the little movement over here?
Yes. I think attitudes play a big part. When we were talking about doing this, Kyla reminded me of an incident that we were involved in that affected her a lot more than it affected me. And I remember the clinical nurse consultant that she was speaking about. I'd seen him many times, and he, like, just as a baseline, kept telling me that all I needed to do was get a boyfriend. And I'm like, super gay. So that was very, very offensive. But like he knew that. I had told him that many times. So it comes down to base levels of things like homophobia, and the way in which we choose to see this westernised concept, this colonised concept of family. I'm also First Nations. So, like, we don't see family the way that kind of, you know, white Australia see family. We have mob, and you don't, you know, your aunt is your aunt, and you listen to everything that an older woman ever says to you ever. So I think it's a fundamental level of respect in that if I say this is the person, then this is the person, and you don't get to question that, pretty much.
Hello. So I've heard the expression favourite person thrown around for people who have BPD, and not really knowing what that definition or that word means. Can you help me understand how chosen family is different to a favourite person?
And we have another mic.
Oh, yes, please.
Here we go.
Okay. Well, Mahlie is my favourite person. But I'm not sure. Do you know the term favourite person beyond just being like...
Weird.
Yeah, it's a weird one.
No offense.
Other than just saying that Mahlie is my favourite person. I guess the thing, like I said, I think that one of the things about chosen family is that, I think it's the stuff that Mahlie was talking about, where we are quite intimately involved in each other's lives, the way that family often are. So, you know, my family actually I live in Sydney. My family live all the way over in South Australia, and I actually am much more intimately involved in Amalia's life than what I am with some of my actual family, just because of distance. And I think that that's kind of just part of, you know, it's different to just your standard run-of-the-mill friendship. It's that actually, you know, this is your person, this is your family, your kin, the people that you do, you know, you support like that, the way that it's often expected that family will.
Yeah.
And, and I think that, like, one of the things that I was going to say in response to Dee's question is that, yeah, I do think that there is a lot of space for actually having greater room and flexibility around our definitions of family working within the public mental health system, because, like, actually sometimes those relationships are more important and more caring than people's actual family relationships, you know, the sort of blood relationships. And that's obviously not universally the case, but, you know, some people actually have very toxic relationships with their family, and it's better if they're not in their lives. And in those circumstances, people should be able to quite easily choose who they want involved in their support and their care.
Just a little bit more to answer your question. I think for me, the definition is that she doesn't get to say no. So, for example, if my course advisor calls her or my doctor calls her, she doesn't get to ignore that phone call, much like a family member. She needs to return it. And there's that, we have a level of expectation of each other that's quite high. So it will mean that, much like many of you who are carers today, if she's doing something else and I call, doesn't happen very often, I'm quite stable, but she needs to step out of that room and take that call. So that's the difference, I guess. That helps. Where's the other?
So I guess this one's probably a little bit more for Kyla. Hopefully, oh, you can hear me now.
Can you project?
Hello.
Oh.
There we go.
No, it's just me that's the problem. Yeah, so how do you go navigating some of the practical stuff outside of the health system? Because certainly my experience is that there's growing acceptance that you might need to be a carer to people you're related to, either your kids or as like a carer for an older adult. But then when you need to take, so for example, like in the workplace, I've needed to take time off to be a carer to my chosen family, who sounds like I have a very similar relationship with, but that's not recognised in the same way that it is otherwise if I was related to them.
Yeah, I mean, I guess I've been fortunate in many ways because during, I guess, sort of some of the periods where Mahlie has needed the most support, I was actually doing a PhD, so I had pretty flexible arrangements with my time and oftentimes would prefer to be doing anything else other than my PhD. And since I've been in my current role, I haven't had to take any time off. Although I do think that my employer probably would be reasonably flexible around that partly because I work in government and they have much more flexible, conditions and workplace arrangements and so on. But I think it's a problem that's very real. Like you don't, workplace relations, you don't just get to choose who you can and can't take time off work for, unfortunately, which I think is, again, it's one of those sort of, it's the problems with the way that family is sort of legally and socially understood, I think, in the world that we live in, that it is actually pretty narrow and doesn't really recognise a range of relationships that exist outside of a pretty narrow definition, so...
I think also, like, Kyla has really, really great boundaries. So, for example, there was one time when my psychologist called her and said, you need to come and get her. You need to take her to her hospital. And Kyla was supposed to be doing a boxing class. And so she was like, we're going to the boxing class, kid. And so we went because she needed to do that for her own self-care before we went to the hospital. And so we went to the boxing class and I ran away and it was hilarious. But, she got me back. And so that kind of stuff, I think we have a lot of boundaries in our relationship and they're very strong. So she's actually on annual leave today to be here, and she was on annual leave last week to be at another conference with me. But we also are really proactive with things. So, like, for example, my birthday is a really, really triggering day for me. It's the most horrible day of the year, and I hate it. And she's normally one of the only people that I would allow to even speak to me on that day. And she wasn't here this year for my birthday, but she told me 6 months in advance that she wasn't going to be there, and we worked around that. And she managed to get to like a Wi-Fi thing in like Turkey or wherever the hell she was, and at least send me a message and say, I know it's your birthday, I know it's shit, but just suffer through it, kind of thing. So I think we proactively look at our calendars and we work stuff out. She'll go home for Christmas and I will lock myself in my apartment. But we've already kind of like looked at our calendars and said, well, when's our Christmas? When do we get to have our time together? So a lot of really proactive stuff, I think, helps with us.
Hello. I would like to acknowledge the pain that you experienced in having your relative contacted when that was unwelcome. I don't really understand how something like that happens. Whenever my family's used health systems and it says next of kin or nominated support person, we will write what we're very much of the chosen family. So did those services go the extra way of finding your family to find contact? What kind of
I'm
things
from New
happen?
South Wales. And so if you're Victorian, we have a very, 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 very different system in New South Wales. It is way more archaic than what you have here.
And I'm from Queensland.
Oh, right, yeah. So you feel me.
Queensland might be further ahead in that.
A little bit, yes. Yeah.
Because I would not see it as lying to say that's your sister.
Yeah.
Yeah.
I think it
and
is-
in fact, I was so heartened to hear that you say that, because that's a recommendation that I can make to my family member when she wants to write next of kin, to put brother or sister.
Yeah.
And I can't see that anyone would question.
Yeah.
I mean, no one's ever asked me to prove who I am
Yeah.
when I'm down as a next of kin. We don't have the same name.
Yeah.
Yeah, so that I think is a legitimate thing to write on a medical form, brother or sister or whatever you would like. Yeah. There's no cheating. I
think I had a different situation. So the instance, just to clarify where my mother was called, was actually in a neurological ward. I'd had a stroke. And my partner at the time was listed as my next of kin. They needed to obtain consent to do an exploratory brain surgery on me. My partner would not give them that consent because she knew me quite well, and she was like, nope, don't cut her brain open, doesn't want that. And so the neurologist had a look through my files, found my mother's name and a previous contact number in my docs records actually, and he took the onus on himself to call her because she gave him consent. Thankfully, they did not have to cut my brain open. It was all right. But that could have very nearly happened. And at that time, I don't think I'd had contact with her for about 6 years. A long time. And I was also a little bit like Aaron. One of the issues that I've had is that being in the foster care system, the child protection system, all of my records are completely public to any doctor that wants to access them. So my docs records sometimes sit inside psychiatric files. And everybody, I don't get the opportunity like other people do to tell my story. My story is there whether I like it or not. And so I think there's a little bit of that going on as well. You know, like it's hard not to know your rights, and I've never really had that sense of having my privacy respected. So it was a horrible situation, but it worked out okay.
Mahlie, just want to check over on this side of the room. I saw a couple of hands, and I know we've got you coming up next, but was there someone else on this side of the room that did have their hands up? Okay.
Hiya. I think part of my question's actually been answered first, but answered already, sorry. I'm not from Australia. So I guess when I listen to your story, I completely understand the chosen family concept. The bit that I'm not understanding is, and this is not for you, it's probably the system, is why is it a problem? Because I guess I'm fortunate, I'm from New Zealand. I'm fortunate enough to have never had, I can't quite fathom the situation that you're even describing because I don't know how it happens. But yeah, I guess any more information you can give me as to how you'd end up in that situation would be helpful. I guess from a personal perspective, I've been in Australia a year. I've probably had 3 instances where I have been really surprised at information that's been passed on without my consent. So New Zealand and Australia has very, from my understanding, similar laws around consent, but the enactment of those laws is really different. So in New Zealand, and I assume here, there's obviously laws around protection and safety, and that's the one time that you can breach confidentiality. In New Zealand, they'd always try and contact you first, or they'd let you know. So it would be a, just so you know, I'm going to talk with this person, do you mind? And explain it to you. So there's never any information shared behind your back. am I answering my own question by describing? Can you tell me a little bit more about what happens in Australia?
I think every Kiwi in this country is kind of confused at everything we do. And I'm sorry, why are you here? Go home. Are you here to mock us? I don't understand. No, jokes. I think it also has a lot to do with the fact that, and I don't know how sectioning works in New Zealand, but a lot of my my inpatient admission, my first admission was at age 7, so I've been in the system for a very long time, and so a lot of it had been involuntary. And under that sectioning, the rights are gone. And so we also in New South Wales don't have a human rights charter like they have here in Victoria that they can use as some kind of leverage. I also think that it's got a lot to do with the diagnosis. So I was treated a lot better when I had the diagnosis of bipolar disorder. But when I got labelled with BPD, things shifted dramatically. And I stopped being involved in conversations. I had a pretty complex presentation as well. So I was often quite aggressive. So I experienced a lot of seclusion and restraint. So once again, once you kind of up yourself into those types of areas, you know, your rights are completely diminished. And so I think that's part of it. I think there was a lot of stigma and discrimination. And also I kind of feel like, for me anyway, doctors or psychiatrists, they wanted to get the answer they wanted. And the people that I was presenting to them, like Kyla, were not going to give them the answers they wanted. Like, you know, she wasn't going to sit by and be like, oh yeah, sure, tie her to a bed. Seems heaps legit. You know, and so that was an issue in that she was often trying to, you know, get them to, I think, you know, be a little bit more compassionate, and often would kind of say, well, I'll take her home then. And they don't want to hear that. They want somebody to comply. They want somebody to say yes to medication, yes to these types of practices. And I think that had a lot to do with it as well. What about you?
We have time for one question.
Were you on a CTO at the time, just out of interest?
I have been on a CTO many times. So it would be, which time are you asking about? Like what specific?
Just if you were on a CTO at the time, I know in Victoria and New South Wales, as you say, it's a different process.
Yeah. Yep.
Whether if you were on a CTO, I was interested to know, was that why you didn't take the first, you know, given your input person, and that this psychiatrist, this clinician felt the need to sort of look further into it?
The last time I was on a CTO, I had no primary carer. So I think Kyla was probably not in the States. She's lived a lots of different places. And so I think, yeah, I don't remember. The last time I had a CTO, I know I didn't. Previous times I'd had a partner, but that partner complied with the CTO. And I had learnt over my many years to appear to apply to my CTO. So, yeah.
So the presentation was beyond Bloodlines, and I think that given some of the narrative around the stories and the difficulties and the challenges that were faced, both of you have presented an absolute beautiful argument for why choice and free will in the choice is so absolutely important, and protection of privacy is so very important as well. Is there any final thing that either of you would like to say?
She told me to say something nice. Which really isn't that difficult, yeah. I mean, I think one of the things is like the thing, it kind of goes back to one of the things that Aaron was saying about, you know, the steps forwards and backwards, which is that like having a caring relationship with someone who has a diagnosis like borderline, it can be a very long, involved sort of journey that you go through. There's steps forwards, there's steps backwards, there's sprints forwards, there's dramatic backslides, there's minor and major relapses, all that kind of stuff. And it can take quite, you know, a long period. And I think that one of the things is just like, you know, you have to have faith and believe that the person can get there. And, you know, Mahlie is a very strong and beautiful, wonderful person, and I've always had the faith that she can get there. And, we do. We get there. We move together.
And thank you for being an example of love in action and sharing that story with us. Could we give them a round of applause?
Thank you.
Thank you.